Hey everybody, Dr. Shah here again, doing a quick video on influenza versus COVID because this is a question that comes up all the time. So let me talk to you a little bit about the differences between these two viruses. So number one, they're both viruses, they're not bacteria. We're all familiar with the difference between viruses and bacteria. Viruses can get you a lot more sick. A lot of times bacteria, you get a quick bacterial infection, antibiotics will take care of it. Viruses have the potential of making you sicker. Now, influenza virus and COVID virus or coronavirus are two totally different families. In fact, here's some pictures of what COVID looks like versus influenza under an electron microscope. They have different antigens on the virus, so the flu vaccines that are out there won't work against COVID because they're two totally different enemies, two totally different viruses. They look different under a microscope and they act very differently as far as your immune system is concerned. Now, at the beginning, I think we all know that this is not true. Most people were like, what is the difference between flu and the COVID thing? In fact, COVID makes mild symptoms in most people, but there's a huge difference between the two, and it's basically in how they act. So let's talk a little bit about how the flu acts versus the coronavirus. So first, the flu season, we see it almost every year. It's about 8 months out of the season. And what's important about that is the flu kind of spreads itself out over time. With COVID, however, with this new virus that we're seeing, it's not spread out over time. In fact, we have an exponential growth curve right now, which means people are getting it more and more as 2 people spread it to 4 people, and those 4 people spread it to 16 people. So it's coming really, really fast. And the problem with that is it's not going to spread itself out. If it were to spread itself out, we could probably keep up with it, and by we, I mean the medical system could keep up with it, and we wouldn't see so many people flooding the hospitals. But because it's not being spread out, the hospitals are going to get flooded, especially in the next couple of weeks. The other big difference is the incubation time, and this is really important. Incubation means from the moment you get the virus to when you start feeling sick. With the flu, it's usually about 1 or 2 days. So basically, you come in contact with someone with the flu, they might have some mild symptoms, or they're pretending they don't have it, and they get you sick. And in a couple days, you're going to get sick. COVID is very different. You're not going to feel symptoms for 5 to 14 days. Some people say 3 to 14 days. So if you're not feeling symptoms, but you still have the virus, you're out there spreading the virus. And imagine if it took you 14 days to feel symptoms, you're going to be spreading the virus for 14 days. So this is a huge factor in why the virus spreads so rapidly throughout a population, because people are out there, they don't know they have it, and they're breathing on other people. The other thing that we need to realize is a difference is the actual symptoms. So the symptoms with the flu, like I said, 98% of people get early symptoms, but with COVID, people can get no symptoms at all. So another reason why this can spread faster. The symptoms themselves are pretty much the same. You get, the fever, the cough, the difficulty breathing sometimes, etc. But because less people get symptoms with COVID and they come later on in the disease process, it's easier to spread this quicker. So the spread with the flu, therefore, is about 8% of the population, and with COVID is going to be about 50% of the population if we don't get this under control with social distancing. And that's where the numbers make a giant difference. So every year, we're seeing a small number of people get the flu compared to the number that we're seeing worldwide getting the COVID virus, because a lot more people are spreading it unknowingly and a lot more people are getting it, and we have a much higher denominator, a much higher number of people getting the virus. So let's talk a little about the immunity to the virus. So with the flu virus, because this has come in and out of our lives for many years, we have some memory of flu in our immune system. This coronavirus, this COVID virus, is called a novel coronavirus, and that's because there's no immunity to it in anybody. No one has immunity to it. There's no vaccines for it. Pretty much everyone that gets this virus has no immune system response to it. And that's bad because a lot of people probably get the flu every year, and because they've been vaccinated or because they have some memory of the flu in the past in their immune system, they're not going to get as sick. So what happens with this? What does this all lead to? Well, the hospitalization rate is very different. The number of people getting really, really sick with this. With the flu, it's about 1%. With COVID, it's about 2 to 4%. So you might say, Dr. Shah, that's not a big difference. 1%, 2 to 4%, why does that matter? Well, it's 1% of a small number compared to with COVID, 2 to 4% of a giant number. and a giant number coming very quickly over the course of a few months. And that's where we have a big problem with the curve of the virus spread outpacing the ability of our healthcare system to keep up with it. The death rate also, because of this, is going to be very different. So with the flu, we know it's about 0.05%, 40,000 deaths every single year. But with COVID, we're going to see a lot more deaths, unfortunately. We're thinking 2 to 4% right now, but remember, that goes up to 10, 20, 30, 40, 50% if the hospitals can't keep up with it. If we don't have ventilators, if the ICU beds are full, if all of our nurses are sick, if all the doctors are sick or overwhelmed, we're going to have a huge problem keeping people from dying with this virus. And so a lot more people end up on the ventilator with the COVID virus than the flu virus. So sorry this paints a grim picture, but I think it's really time for us to get serious about this virus. Anyone who's out there who's going to the park with friends or avoiding social distancing because they think all of this is a big farce, you're absolutely wrong. You have to take this seriously. If you're not social distancing, you're the reason this problem is occurring with COVID, and it's time for you to start following the recommendations of the CDC and all the health departments and the local governments. Please reach out to me by direct message or by commenting here if you have any more questions, and I look forward to doing some more videos for you.